talks about antiemetic and anti-nausea drugs. So we're moving to the other end of the GI system. Like always, we want to start out with definitions. Nausea is that unpleasant feeling that often precedes vomiting. Emesis, or vomiting, is forcible emptying of the gastric and occasionally the intestinal contents. Antiemetic drugs are used to relieve nausea and vomiting. Yes, we have a vomiting center. We also have a chemoreceptor trigger zone, and both of those are located up in our brain. So when we get stimulation from the GI tract or from the labyrinth in our inner ear or messages from the cerebral cortex hits this chemoreceptor trigger zone, it stimulates the vomiting center in our medulla, and once it's stimulating, vomiting starts up. Not sure why our book decided it had to define the different types of nausea and vomiting, but we can have chemotherapy-induced vomiting. There's other drugs as well that may induce nausea and vomiting with us. There's post-operative vomiting. It's often related more to the anesthesia drugs that were given than to the surgical procedure itself, and then just general nausea and vomiting that we get from various causes. So there's a number of different varieties of antiemetics and anti-nausea drugs. Anticholinergic drugs will help with it, antihistamines. And the antihistamines that we're talking about now are the H1 receptor blockers, not the H2 that we were talking about with the gastric secretions. Antidopaminergic drugs, neurokinin antagonists, prokinetic drugs have a tendency to kind of push things on through. Serotonin blockers and tetrahydrocannabinoids. When we look at the mechanism of action, there's many different mechanisms of action depending on the drug, but most work by blocking one of the vomiting pathways, thus blocking the stimulus that induces vomiting in the first place. The indications vary depending on the class of antiemetics. There's a general use for each type, the prevention and reduction of nausea and vomiting. Mechanism of action and some of the other indications for these different drugs. Anticholinergic drugs are acetylcholine blockers, and they bind to and block the acetylcholine receptors in the inner ear labyrinth. They block transmission of the nauseating stimuli to the chemoreceptor trigger zone. They also block transmission of nauseating stimuli from the reticular formation in the body. Scopolamine is one example of this. And if you think about what scopolamine is often used for, it's used for motion sickness. So here's our first question about nausea and vomiting. The nurse is preparing to administer scopolamine to a patient. It is most important for the nurse to determine if the patient has a history of which condition: cataracts, narrow-angle glaucoma, presbyopia, or detached retina. So the answer on this one is B, narrow-angle glaucoma. The nurse should only administer the anticholinergic drug scopolamine after careful assessment of the patient's health history and medication history. I want you to think back to when we were talking about these anticholinergic drugs, and we kept seeing this narrow-angle glaucoma coming up as a contraindication. One very important concern to re-emphasize with scopolamine, which is commonly administered in a patch form to prevent motion sickness, is that the contraindication to its use in patients with narrow-angle glaucoma. If the patient has a history of this disorder, then another antiemetic or anti-nausea drug should be used instead. The antihistamine drugs, the H1 receptor blockers, inhibit acetylcholine by binding to the H1 receptors. They prevent cholinergic stimulation in the vestibular and reticular areas, and that results in preventing nausea and vomiting. It's also used for motion sickness and non-productive cough, allergy symptoms, and sedation. So the examples of those would be dimenhydrinate, which is Dramamine, or diphenhydramine, which is Benadryl, or mesclunazine, which is Antivert. Antidopaminergic drugs work by blocking dopamine receptors in the chemoreceptor trigger zone. It is also used for psychotic disorders and intractable hiccups, so people who just hiccup and can't stop. Examples of these are prochlorperazine or compazine and promethazine, which is Phenergan. Droperidol is controversial because it's associated with cardiac dysrhythmias. Neurokinin receptor antagonists inhibit the substance p-neurokinin 1, which has receptors in the brainstem. It's used in conjunction with serotonin blockers and glucocorticoids. The use augments the serotonin blockers and the glucocorticoids to inhibit acute and delayed phases of chemotherapy-induced emesis. And examples of these are aprepitant and fosaprepitant. Prokinetic drugs block dopamine receptors in the chemoreceptor trigger zone, and it causes this chemoreceptor trigger zone to be desensitized to impulses it receives from the gastrointestinal tract. It also stimulates peristalsis in the GI tract, and that enhances emptying of the stomach contents. It's also used for gastroesophageal disease and delayed gastric emptying. Metoclopramide, or Reglan, is an example of this drug. And long-term use may cause irreversible tardive dyskinesia. Tardive dyskinesia is involuntary movements, and so, yeah, it's not a pleasant thing to have. You'll also find tardive dyskinesia comes with a lot of psych meds as well. So a patient is receiving a continuous tube feeding via a percutaneous endoscopic gastrostomy tube. Which drug would most likely be prescribed for this patient? Metoclopramide, meclizine, aprepitant, or phosphorated carbohydrate solution? Well, the answer to this is A, because metoclopramide is a prokinetic drug that promotes the movement of substances through the GI tract and increases GI motility. This action is helpful in preventing aspiration in those that are receiving tube feedings. Serotonin blockers block serotonin receptors in the GI tract, and the chemoreceptor trigger zones and the VC, the vomiting center. It's used for nausea and vomiting in patients receiving chemotherapy and for postoperative nausea and vomiting. So examples of these are dolasetron, ganasetron, ondansetron, or paloestron. So if you look at these, they're all ending with the setron. And so serotonin, cetron, cetone. So find ways to kind of put these together in your head. The most common one that I see used is sofran, the ondansetron. The tetrahydrocannabinoids are major psychoactive substances in marijuana, and they have an inhibitory effect on the reticular formation, the thalamus, and the cerebral cortex. They alter mood and the body's perception of its surroundings, which may help to relieve nausea and vomiting. A patient with terminal cancer has not had chemotherapy for a few weeks and has had no nausea or vomiting since then. However, he is taking dronabinol twice a day. The reason for the dronabinol order is to prevent the reoccurrence of the chemotherapy-induced nausea and vomiting, prevent stress ulcers, improve his mood, or stimulate his appetite. The answer to this one is to stimulate his appetite. Dronabinol is used as an appetite stimulant in patients who are experiencing nutritional wasting caused by cancer and cancer treatments. Examples of tetrahydrocannabinoids are dronabinol, and it's used for nausea and vomiting associated with chemotherapy and for anorexia associated with weight loss in AIDS patients. A patient is 2 months pregnant and she comes to the clinic complaining of severe morning sickness. She tried numerous non-pharmacologic measures to relieve the morning sickness, but they have not worked. The nurse anticipates the use of which anti-nausea drug? Phosphorated carbohydrate solution, aprepitant, plasnosterone, or dolasterone? The answer here is A. Phosphorated carbohydrate solution is a mint-flavored, pleasant-tasting oral solution used to relieve nausea. It works by direct local action on the walls of the GI tract, where it reduces cramping caused by excessive smooth muscle contraction. It can be used to control mild cases of nausea and vomiting. It does not have a pregnancy category rating, but one of its listed unlabeled, as in not approved by the FDA, uses is for the treatment of morning sickness during pregnancy. The other drugs are not indicated for use during pregnancy. So the adverse effect of these anti-nausea drugs vary according to the drug that's used, and it stems from their non-selective blockade of various receptors. Which group of drugs is used to treat nausea that does the nurse identify as the most likely to cause prolonged QTC interval? So this is your QRS, so the interval between your Q wave and your T wave. Prokinetics, antidopaminergics, tetrahydrocannabinoids, or serotonin blockers. The answer to this one is D. The serotonin blockers have a potential to cause prolonged QTC intervals. So not to be left out, let's talk about some herbal products. Ginger is used for nausea and vomiting, including that nausea and vomiting that's caused by chemotherapy, morning sickness, and motion sickness. It's why people have a tendency to drink ginger ale when they feel a little nauseous or have motion sickness. The adverse effects of ginger include anorexia, nausea and vomiting, and skin reactions, which is really kind of interesting considering the nausea and vomiting is why you're taking it. The drug interactions, it may increase the absorption of some oral medications, and it may increase bleeding risk with the anticoagulants. A patient tells a nurse that he takes ginger almost every day for nausea. It is most important for the nurse to determine if the patient is taking which medication: furosemide, acetaminophen, warfarin, or calcium supplements. Well, this one should be a no-brainer by this point in time because we already know that warfarin doesn't play nice with almost any other drug. So the use of ginger can increase the absorption of all oral medications and may theoretically increase the bleeding risk with anticoagulants or antiplatelet drugs. Finally, we're up to the nursing implications. You want to assess complete nausea and vomiting history, including the precipitating factors. You want to assess their current medications, assess for contraindications and potential drug interactions. Many of these drugs cause severe drowsiness, so warn patients about driving or performing any hazardous tasks. When taking antiemetics with alcohol, it may cause severe central nervous system depression. So definitely don't take these with alcohol. You want to teach patients to change positions slowly to avoid hypotensive effects. For chemotherapy, antiemetics are often given 30 to 60 minutes before the chemotherapy begins so that it can start to work before they start feeling sick. You want to monitor for the therapeutic effects and, of course, monitor for the adverse effects as well. And that concludes this one.